I think I messed up choosing physiology as a career. Yeah, you got it right. Did you? Did you really mess up? I know that's how you feel. Why? Because you must have been aspiring for medicine or health science courses for years, and you could not make it into any of them due to competition. Or maybe you don't really care much about the course, you just want to leave your house and enter college as fast as you can. Dang it. You entered the university. It's not really what you thought it to be. You are now confused on what to do next, or how to go about life as a physiologist. Most times people will ask you what you really study, and you find it hard to explain in simple terms what it is that you really do in the hospital. It's even worse when it comes from your fellow medical student or course mate. Before we dive into the topic, let's first of all define the professional, who is a physiologist. Physiologists are healthcare professionals. Their job involves examining and monitoring physiological organs of the human body to diagnose and offer treatment for physiological disorders and long-term illnesses. How do they do this? In hospitals or clinics, they often work with a variety of machines and instruments to conduct their work. In hospitals, they may use machines like EKGs, ECGs, and ultrasound machines to monitor and diagnose patients. In research institutions, physiologists may use machines like mass spectrometers, MRs, and DNA sequencers to study biological samples and analyze data. Some of the top hospitals you can find physiologists are University of Ibadan Teaching Hospital, Lagos University Teaching Hospital, and Ahmadu Bello University Teaching Hospital. So say the least. Many also work in federal medical centers and private sectors. You can just move around hospitals near you, and you'll surely meet them. Not to mention platforms like LinkedIn, you'll meet more than 1,000 of physiologists in different specialties and states in their different workplaces. You may be surprised to discover that one is living at your backyard. Do you know that as a physiologist you can affiliate with a hospital and open an ECG, electrocardiogram lab in Nigeria? An ECG lab provides services such as ECG monitoring, diagnostic testing, and patient education. There are also numerous popular clinical physiologists like Folarinle T. Akinrinlola. Shez is the first cardiac physiologist in Nigeria. To date is responsible for training a significant number of physiologists. She began her career in the United Kingdom, where she worked over a period of 11 years with several top-notch hospitals as a cardiac physiologist. She left her position as chief cardiac physiologist with St. Anthony's Hospital, Surrey, United Kingdom, to return to Nigeria, where she joined the Pioneer Cardiac Surgery team as its head cardiac physiologist. As head cardiac physiologist, she set up and managed cardiac and echocardiogram services, as well as its pacemaker implantation program and clinic. She also acted as consultant, non-invasive services to First Cardiology Consultants Hospital, for which she coordinated its non-invasive department and the cardiac catheter laboratory. Not to mention Professor Olatunji Bello, who's a highly successful scientist. She then became first professor of physiology in Nigeria in 2007. She is known for her brilliant academic work, and she has over 56 publications to her credit. This type of physiologists work in research centers and study a variety of topics, including the effects of diseases like malaria on the body, the use of traditional medicine, and the health effects of urbanization and climate change. They work with other healthcare professionals to develop new treatments and therapies for diseases that are prevalent in Nigeria, such as sickle cell anemia and heart disease. They often collaborate with other researchers around the world to share knowledge and findings. These physiologists use computer software to model and simulate various physiological processes. These physiologists often use microscopes, incubators, and other laboratory equipment to conduct their research. And final on the list, do you know that you can travel abroad as a physiologist and work? You can work in the NHS UK and make minimum of £40,671 annually. In UK, there are lots of spaces for sleep physiologists, cardiac physiologists, lung physiologists, and respiratory physiologists, you see? That's why you need to work hard and equip yourself with the necessary information and skills to be able to fit into most positions and reach high potentials as a physiologist. The limit to what you can achieve is you and yourself. Physiology is broad and lucrative. You can also go into exercise physiology, though you'll need to advance and further your academic pursuits by earning more degree in biomechanics and more knowledge in anatomy and physiology, which can be obtained by going for masters in exercise physiology. With this advanced degree in physiology, you can go into private practice and establish your own personal gym center, where you can attend to people and make extra cash. You see what you can do or become with physiology degree. It's the very heartbeat and function of medicine. Why physiology seems dull and challenging is due to lack of much investment into research and medical technology, but with years to come, it will be one of the most sought out for in medical practice and medical profession. Thank you for watching. Please remember to like and subscribe.